Hello, everyone, and welcome back to another episode of Canopus Chats with JD Price. I'm so excited to know that you've been watching my channel, you've been liking, subscribing, and you've been sharing, and I think that is awesome. So thank you, and thank you. Don't forget to ding that bell and show that you like and be abreast when new episodes have been released. Well, everybody, I am so excited to introduce my guest to you today, none other than Dr. Jennifer Okhiria. And I'm going to allow you to give her a round of applause. So welcome, Doctor. How are you?
I'm doing well. How are you?
Awesome. It's really a pleasure to have you on Canopus Chats, and I'm looking forward to our conversation. So I have these three cards in my hand, and I'd like you to pick one, and this is where it's your choice, so you'll get to tell us about your I am statements. Go ahead.
I picked number one.
All right, so is this one? No. I know. All right, so you are number one. What does number one says? Number one says, I am an oral surgeon. So tell us about that.
So yes, I am a oral and maxillofacial surgeon, and I was trained as a dentist, but later specialized as a surgeon of the mouth, the jaw, and the face. So on a typical day, what I do is see patients in my private office for dental issues like broken teeth, wisdom teeth, implants, and I also work in the hospital where I fix diseases or trauma of the jaw, like from a broken mandible or a cancer or a tumor. So we're pretty much a specialist of the jaw and the face.
I see. Okay, that sounds really exciting. So tell me, what was it that drove you to choosing a career in dentistry?
Well, I have a very interesting story. So I am actually a third generation dentist. My mother's father was a dentist, and my grandfather's father was a dentist. So it did skip a generation with my mom, but I am the third in my family to be a dentist. So I was exposed to the field of dentistry at a very young age, and when it was time for me to make decisions on my life path, it just felt right. I knew there was a great need in my community for dentists and surgeons that looked like myself, so I just knew that God kind of led me in the right direction to be an oral surgeon.
Wow, so you had the family history and you just pick up the mantle. Did you feel any pressure in choosing this career path, in that it has such historical significance to your family?
I really didn't feel any pressure. I mean, my parents are college educated. They just wanted us to just strive to be the best, you know. College was a given, and whatever you do beyond that, as long as you're at the top of your field and you're always trying to improve and be good and be the best that you can be in your field, then that was it. So I never had any pressure. I just kind of knew that it was meant for me because of the exposure I had at such a young age.
Wow, that's awesome. So the field of dentistry in itself is competitive, but even being an oral surgeon, to specialize in the areas that you are, what kind of preparation or what does it take to become an oral surgeon?
It takes a lot of school. So after I finished high school, I went to college. I went to all women's college, Spelman in Atlanta. And that 4 years that I majored in biology. So you typically want to major in the sciences because that is basically what our field is about, the humanities or the sciences.
Right.
After I went to Spelman and got my undergraduate degree in biology, I went to dental school at the University of North Carolina, Chapel Hill, and the dental school was 4 years.
Right.
And so when I graduated, I had my doctorate of dental surgery, my DDS, and I just knew it was something else for me. Right. So instead of me becoming a general dentist, I craved for something more, something different. So then I applied to a residency in oral and maxillofacial surgery, or oral surgery to be short. Right. And this residency varies. There are 4-year programs and there's 6-year programs. So after dental school 4 years, I was accepted into a 4-year program. And during this training program, we're immersed into oral maxillofacial surgery. We see patients in the clinic. We go to the operating room and do a lot of surgeries. We do a rotation in trauma surgery with the general doctors and general surgeons. We do rotations in anesthesia for 6 months. We do cosmetic rotations. So we get a lot of exposure to all the different types of surgery of not just the head and neck, but to the whole body.
Right.
So after my training of 4 years at my hospital, then we have to take an exam called our board exam. So this is the exam that pretty much solidifies that you are a trained expert in your field. And it takes 2 years to get certified with this exam. So after the last year of residency, I start studying for my written exam. So it's like a 4 to 5 hour written exam in front of a computer. And once you pass that, you qualify for the oral boards. And the oral boards is tough. It's a whole day where we have to fly to a center in Texas in Dallas. And we're literally in a room for about 3 or 4 hours. And the examiners come to the room 2 at a time. There's a computer there. There's a bottle of water, and there's like a little notepad, and they literally ask you questions for hours about different cases, treatment planning, diagnosis, surgical variations. So they really want to know if you really know this stuff. So, and I was fortunate to pass, and after that I became board certified. So this is the highest that I could have gone in my training.
And that did not happen overnight. That was extensive work and training and preparation. Jennifer, this seems so immersive, as you said before. Along the way, did you ever feel like maybe giving up because this required so much of you?
Yes, I had multiple times during my residency where I questioned if it was for me. And it was mainly because I felt alone. I was the only minority female at a point in my residency. And, you know, from where I'm from and how I was always raised with a community of people that looked like me, that had the same interests. But in my residency, I'm with all different types of people who just don't have the same interests or background as me. So at times I felt very isolated, you know, but I do have a very good support system, and with my family and my friends, and, you know, I met people during my residency that really kind of supported me and told me that I had a destiny for my life. So, you know, there were a lot of times where I questioned, you know, why I was there, why God was putting me through it, but I persevered. I stuck to it, and, you know, I kept my eyes focused on the prize, and, you know, there was a light at the end of the tunnel.
Wow, that's awesome. I think just hearing this, it's important to know that when you have, you know, when you have a goal in mind and you have fixed your mindset on achieving this goal, that it is not unlikely that you will feel deterred, but you just have to continue to persevere. I also like what you said in terms of having a support system that can really help to sustain you and to encourage you to fulfill your goal. Now, you talk about feeling alienated in this area that does not have enough representation. That really leads me to my next question, because the field is rather competitive, as I said before. How do you, being a woman, a mother, and person of color, flourish in this industry? So you went through the program, you completed the program successfully, and now you're in the industry. How do you flourish?
Well, I think there is a place for everybody. And I was just looking at the statistics of Black female oral surgeons this past summer, and the statistics are very grim. I think there's probably less than 6,000 practicing oral maxillofacial surgeons in the country. And of those, maybe less than a few hundred Black practicing oral surgeons, and of those, maybe a few dozen Black women. And it's unfortunate that I know a lot of the Black women oral surgeons in the country. And so I think that is a disadvantage because it's not that many of us, so we do support each other. And there's a market or niche for me where I am in the city of Atlanta, because there's not that many Black females in Atlanta. And, you know, this is a male-dominated field, and for me to be a minority female, I think I'm able to connect with a lot of women, a lot of minorities, and people from other ethnic backgrounds. So, you know, they see my last name, they're like, oh, wait a minute, you know, but then they see my picture on the website, like, okay, all right, you know, so, and it's just something different because, you know, like I said, it's a very male-dominated field. I'm in the South, so everything is pretty much the same. So I'm doing well, and I feel that my patients bring their family members or their friends, and so that is a good sign that I am, you know, having an impact where when they come to the oral surgeon, they can relate to me, or they see somebody that is reflective of their background.
Right. You know, you kind of alluded to the fact that trust is important. And I was going to ask you that since the expectation, because of it's the male involvement and their dominance pretty much in this area, if when the patients come to see you and they realize that you are a woman, do they behave differently, or do they trust you to do the work?
Well, it can go either way, because I have gotten some negative comments, you know, where, well, they question, you know, how long I've been doing this, or am I qualified, or, you know, they think I'm too young. So, I mean, it doesn't hurt me because these people just are not exposed. They have not seen a young Black female as an oral surgeon. So they don't know what to expect, you know? So I do get some of those negative comments, you know. I've overheard people say, well, what happened to the old guy, the old oral surgeon, you know? Well, the old oral surgeon retired. I'm pretty sure I want him doing your procedure because he's in retirement. On the contrary, I do get some positive feedback where, you know, I get some old grandmothers just like, I'm just so proud of you. And, you know, I'm just so proud. And, you know, I do have a connection, or, you know, my last name is Nigerian. So because it's an ethnic last name, I do get a connection with those that may not be from America, you know? So it's I do get both sides of it, but you know, with the bad, it's always more good than outweighs the bad when it comes to that.
Okay. Yeah, I like your outlook, very positive, and also just sharing the balance. So with the negative comment comes the supportive role of the matriarchs, and even, you know, the extended family members that we don't even know. And I think that really says a lot. Now, as a parent and a young professional, how do you achieve work-life balance? I am so curious.
Well, I'm starting to believe that it is not impossible, but very difficult to achieve the perfect balance. And I read somewhere that there is an analogy that the professional woman that is a wife and a mom, it's like we have to juggle multiple balls at the same time, you know? And she said, sometimes you're juggling glass balls or plastic balls. And the glass balls are the precious ones. You can't drop those because they were shattered. You can't repair them. The plastic balls, you can drop them, they'll bounce. You can pick them up, they'll be fine. And so with the work-life balance, you have to know at what point in your life and your career is which aspect is a glass ball and a plastic ball. Like my girl's eating green beans at dinner, you know, it's not that serious, you know. You just let it go, you know. Doing or missing a recital for them, that's pretty major, you know. So you have to be able to realize what is important at that time in your life. So my girls are really small. They're 4 and 1 years old.
Mm-hmm.
So I think just me physically being there is the most important thing. They don't care about what I look like or, you know, mommy did have this or this gift or whatever. It's just my physical presence.
Right.
But in a few years, they're going to need my mind. I'm going to have to really speak, you know, life into them, really teach them, really engage with them. So I can't just be stressed out about my day and bring it home. I'm going to not only have to be physically present, but mentally present. So I think work-life balance is possible. I don't think you can have it all at the same time. There's just some things that just not worth having it. I mean, I could be a superstar at work and kind of slack off at home because, you know, my kids, they'll be okay, you know. If they skip a bath this one night in a week, they'll be fine, you know. You just have to know what point you are in your home life and your work life, and what can be let go.
Okay, awesome. So this is such an eye-opening as well as very informative session where we looked at your journey and how you got to where you are today and the contribution that you are making and where you're going. As I wrap up our segment, can I just ask you one last question?
Sure.
So tell me, what do you do for fun?
What do I do for fun? You know what? Well, pre-COVID, I have a little shopping habit.
Oh.
That my husband really doesn't know about. I don't go crazy, but I like to buy little accessories, a bag here, a little shoe here. And, you know, when I've had a rough day at work, it's Friday, and I get out a little early, I like to just go to the mall, and I like to just walk around. It's just about going into a store, and then you just seeing new stuff with tags, and, you know, 90% of the time I don't buy anything, but I don't know. I just like being in a mall. I like to just, you know, look around and get ideas and then just go home, you know. But I watch TV, but I don't really binge watch shows. I'm not heavy like on social media. So I honestly like to just be out, you know. I like to spend time with my husband. I like to eat, like to go to restaurants. But this year, you know, it's been a very different year. I have appreciated just staying home, you know, cooking and really doing activities with my girls more versus doing activities outside the home. So I think now this year has kind of done a reset for me, and I really focused on what has been important, and it's God and family.
That's beautiful. Dr. Okhiria, thank you so much for this insightful conversation into oral surgery, your path, the choices that you've made that have gotten you to where you are today. And I know that by just telling us your journey, your choices, your story, that someone's life will be made better just hearing this. And thank you for being such an inspiration to all of us. And good luck as you continue your journey. Hello, everybody at Canopus Chat. This is JD Price signing off. And just to say thank you, Dr. Jennifer Okhiria, for speaking with us today. It was our pleasure.
Thank you so much for having me.
You're welcome.